Chapter 14, Substance-Related and Addictive Disorders, Part 2. Sedative, hypnotics, analytic compounds are of diverse chemical structure. These drugs cause a CNS depression, and that depression can range from tranquilizing relief to anxiety to anesthesia, coma, or even death. So refer to Table 14-1 in your text. So we have barbiturates, non-barbiturate hypnotics, and anti-anxiety agents is also called anxiolytics. Sedative hypnotic use disorder. So the pattern of use can be a determinant in whether an addiction exists. So if it's prescribed to be used for anxiety or prescribed to be used for um, insomnia or to sleep, but it's being used outside of those windows or outside of those parameters, therefore addiction may be present. And here are some of the effects that sedatives and hypnotics may have on the body. So intoxication. So the CNS is depressed with sedatives and hypnotics. This depression can cause a range of symptoms, including coma and death. Withdrawal symptoms. So onset depends on the half-life of the drug, when a person will start to withdraw. And severe withdrawal can be life-threatening. As I mentioned with alcohol, I believe their withdrawal period was 4 to 12 hours. And if they are a heavy drinker, it could be fatal if they stop drinking abruptly. So stimulant disorder. So the central nervous system stimulants are identified by the behavior stimulation and the psychomotor agitation that they induce. So here's a list of the stimulant um, drugs. Patterns of use. Many individuals who abuse or are addicted to CNS stimulants begin with the use of appetite suppressant drugs in an attempt to control their weight. So some of the effects on the body include central nervous system effects, cardiovascular effects, pulmonary, gastrointestinal, and sexual function. Amphetamines and cocaine intoxication produces euphoria, impaired judgment, confusion, changes in vital signs, and can even result in coma or death. For caffeine intoxication, the person must consume more than 250 milligrams of caffeine, and this may produce restlessness and insomnia, which are the most common symptoms. Amphetamine and cocaine withdrawal may result from dysphoria, fatigue, sleep disturbances, and increased appetite. Withdrawal from caffeine may include headache, fatigue, drowsiness, irritability, muscle pain and stiffness, nausea, and vomiting. Withdrawal from nicotine may include dysphoria, anxiety, difficulty concentrating, irritability, restlessness, and increased appetite. Inhalant use disorder. So, inhalant disorder are induced by substances such as fuel, solvents, adhesives, aerosol propellants, and paint thinners. Common examples include gasoline, varnish, remover, lightning fluid. As inhalant substances are readily available, legal, and inexpensive, they are a drug of choice amongst children, teens, and young adults. So some of the effects on the body include CNS effects, respiratory effects, GI effects, renal effects. The substance may be inhaled directly from the container or sprayed in the mouth or nose. Inhalant-induced disorder. Intoxication develops during or shortly after the use or exposure to the inhalant. And some of the symptoms are listed here of inhalant use disorder. Opiate use disorder. So the profile is that opioids are of a natural origin. They are derived from opium. Synthetic opiate-like drugs exist as well. And although opioids are used in medicine and are very necessary for treatment of pain, however, they do have a pleasurable effect on the CNS, which makes it high risk for abuse. Opiate use disorder continued. So the pattern of use. So again, if it's prescribed, you use it for the reason it's prescribed. If you're taking the drug outside of those parameters, then it's a great possibility that you are abusing the drug or you are developing an addiction to the drug. So tolerance will develop after use and then will require higher dosages of this particular medication. So I do want to mention in our country there is a opioid epidemic. So I do want to emphasize that now there's very stringent um, timelines for how much medication can be given out for opioids as well as other forms of narcotics, as, and they are trying their best not to order these drugs unless absolutely necessary. So here on your slide, it lists some of the effects that it has on your body. Opioid-induced disorder, so intoxication. So the intoxication period will begin according to the half-life of the drug, and it can last up to several hours. Severe opioid intoxication can lead to respiratory depression, coma, and even death. And then you have the list of symptoms that this drug class can um, produce in your body. So euphoria, which is the number one reason why it is so highly abused. Apathy, dysphoria, psychomotor agitation, retardation, and impaired judgment. Here are some symptoms of opioid withdrawal: dysphoria, muscle aches, nausea, vomiting, tears, runny nose, dilation of pupils. So short-acting drugs such as Heron, withdrawal symptoms occur within 6 to 8 hours after the last dose. Peaks within 1 to 2 days and gradually subsides over the period of 5 to 10 days. Longer acting drugs such as methadone, withdrawal symptoms begin 1 to 3 days after the last dose. Peak begins 4 to 6 days and are completed by day 21 or between 14 to 21 days. Withdrawal from ultra short acting meperidine begins quickly, reaches a peak at 8 to 12 hours, and is completed in 4 to 5 days. Hallucinogen use disorder. So hallucinogen substances are capable of distorting an individual's perception of reality and their ability to alter sensory perception and induces hallucinations. So it's naturally occurring hallucinogens, and we have synthetic compounds, which are hallucinogens. And the pattern of use is usually episodic. So see table 14-5 in your textbook, and it talks about the different hallucinogens. The effects produced by hallucinogens are highly unpredictable. They vary according to the dose, the mental state of the individual, as well as the environment in which the substance was used. These effects are not always pleasurable, and toxic reactions such as intense levels of anxiety, fear, and stimulation can occur. Flashbacks or spontaneous repetition of a previous experience may occur in the absence of the substance. And here are some of the physiological and psychological effects on the body. I will not read them all, but I will read some. So we have insomnia, loss of appetite, elevated blood sugar. These are physiological effects on the body, chills, pupil dilation. Psychological effects can be paranoia or panic, euphoria, peace, distorted vision, sense of slowed time. Intoxication occurs during or shortly after the use of the drug. So here are some of the symptoms. Cardiac symptoms are listed: are tachycardia, fast pulse, palpitations, depersonalization, derealization, perceptual alteration. Some of our symptoms include belligerence, assultiveness, and may proceed to seizure or coma. Cannabis use disorder. So cannabis is also known as marijuana and hash. It is the most commonly used illicit drug in the US and the fourth most commonly used psychoactive substance after caffeine, alcohol, and nicotine. So here are some of the effects of cannabis on your body. So it affects cardiovascular, respiratory, reproductive, CNS, and sexual functioning. Cannabis intoxication may produce the following symptoms: impaired motor coordination, euphoria, anxiety, sensation of slowed time, impaired judgment. Physical symptoms include conjunctiva, injection, increase appetite, dry mouth, tachycardia. Impairment of motor skills lasts from 8 to 12 hours. Withdrawal symptoms occur within a week of stopping the consumption of cannabis. So, some of the symptoms of withdrawal for cannabis include irritability, anger, aggression, sleep difficulty or disturbances, appetite or weight loss, decreased appetite, weight loss, depressed mood, abdominal pain, tremors, sweating, fever, chills, and headache. So the next 14 to 15 slides talk about the nursing process for substance use or substance related disorders. I'm referring you to table 14-10. We will go over each slide briefly. Table 14-10 has care plans in reference to substance related disorder. So first, before we start to implement the nursing process, our first step is to develop a rapport and a relationship with our patient. And during that patient development of relationship or rapport, we are going to do something called motivational interviewing. So, motivational interviewing can be used in any clinical study or to attain assessment information, and you are focused on exploring the client's motivation, strengths, and readiness for change. So this gained its popularity with substance use disorder. However, it can be used in any clinical setting. So in our assessment process, we may utilize several different tools to help us assess our client. So I will mention a few. However, there are several, and several listed on our slide here. So you can get just a drug history during your assessment period. Or you can use the clinical institution withdrawal assessment of alcohol scale. So this may be used initially and also as an ongoing monitoring of alcohol withdrawal symptoms. Then you have something called Michigan Alcohol Screening Test and the CAGE questionnaire. So here are some of the questions from the CAGE questionnaire. So have you ever felt like you need to cut down your drinking? Cut for our C. Have people annoyed, A for annoyed you by criticizing for the drinking? Have you felt bad or guilty? G for guilty. So we're spelling cage, right? Have you ever had a drink the first thing in the morning or to steady your nerves? E for eye opener. Clients with a coexisting substance disorder and mental disorder may be assigned to a special program that targets the dual diagnosis. Program combines special therapies that target both problems. So here's a nursing diagnosis and a related outcome identification. So ineffective denial related to weak, underdeveloped ego, nursing diagnosis, right? Then our outcome or what we desire or our goal is our client will demonstrate acceptance of responsibility for own behavior and acknowledge association between personal problems and the use of substances. So our nursing diagnosis is ineffective coping related to inadequate coping skills and weak ego. And the goal or outcome for that nursing diagnosis, client will be able to demonstrate more adaptive coping mechanisms that can be used in stressful situations instead of taking substances. So here are two nursing diagnoses and goals for each. I'll read the second one. So risk for infections related to malnutrition and altered immune condition. Our goal, no signs, uh, no signs or symptoms of infection. So we mentioned in part one about the risk factors being someone who has low self-esteem. So here is a nursing diagnosis for that individual. Chronic low self-esteem related to weak ego, lack of positive feedback. Goal or outcome, exhibits evidence of increased self-worth by attempting new projects without fear of failure and by demonstrating less defensive behavior towards others. So here's the nursing diagnosis for knowledge deficit, and the goal is to verbalize the importance of abstaining from the substance. So this is someone who's denying their problem, who has deficits of the abuse or substance misuse diagnoses. For clients withdrawing from CNS depressants, they are at risk for injury related to CNS agitation. So that sounds like something you should know as a nurse, right? For the client withdrawing from CNS stimulants, they're at risk for suicide related to intense feelings of lassitude and depression, crashing, suicide ideation. Planning, implementation. So risk for injury, you want to plan for a safe, supportive environment and administer substitution therapy. For denial, you want to develop trust, identify maladaptive behaviors or situations. Implementation continued. So ineffective coping, you want to establish trust, set limits or boundaries, and explore options. For dysfunctional family process, review history, provide information, and involve the family. Client and family education. So you want to make sure they're educated about the nature of the illness, that they know that addiction is a disease and it is not just something that a choice that someone made. You want them to know the effects of the substance on the body. You want to also educate them on ways in which use of the substance affects their life. So educate the client on how to manage their illness. So they should have a plan together about what they will do in stressful times, right? So maybe go for a walk, maybe talk to someone, but avoid going back to the habit of using a substance to relieve stress. Relaxation techniques. So you want to make some suggestions: deep breathing, um, progressive relaxation, autogenics, problem solving skills. So, what types of strategies did they develop in treatment to help them cope? And it is essential for good nutrition, especially for our alcoholic patients because they tend to have that thiamine deficiency. But you want to make sure all of your patients and realize the importance of nutrition on the health of the body. Client and family education about support groups. So, financial assistance, they may have gotten themselves into a financial bond with their addiction. So, you do want to inquire about that, or legal assistance if they got into some type of trouble. Um, then you want to be able to refer them to different resources, support groups such as AA, Alcoholics Anonymous, or one to one peer support. And lastly, in our nursing process, we have evaluation. So you always want to evaluate your plan of care. So evaluation involves reassessing to determine whether the nursing intervention has been effective in achieving the intended goals of care.